thank you for taking time to talk with us and to help me and the students to better understand about what your role is, Allison. And if you could please just introduce yourself, and if you want to share any preferred pronouns, that's fine. And then the first question I would have for you is, what is your role?
Absolutely. Well, thank you for having me. My name is Allison Riederer. My pronouns are she, her, and I am a registered dietitian. I have held a lot of different roles as a registered dietitian. At present, I am actually the director of the program here in the School of Public Health that trains dietitians with a public health lens. But previous to this, I've been in inpatient clinical settings, outpatient clinical settings, community settings, pretty close to everything under the sun a dietitian can
I
do.
realize it'd be hard to describe all the different days that you in your different roles, but what's a typical day for you like now?
Yeah. Well, now that I'm in exclusively an academic setting, my typical day revolves really heavily around a lot of specific kind of educationally directed things. So I will go kind of back in time in my career, and I'll talk about a day in my work when I was in clinical nutrition. So in clinical nutrition, in an inpatient setting, I would come in and I would have a set number of floors that I would cover, or units that I would cover. And the first thing in the morning, so I worked in a VA hospital, so a veterans hospital out in Salt Lake City, Utah. So I would come in the morning and I would open up my computer and I would get my list of alerts for that day. And that list was basically my list of priority patients on my units and floors that needed some form of attention from me, or assessment and care from me and our nutrition team. And I would get that list, and it would be consults from other providers. It would be automatic alerts that are generated by lab values, or anthropometric changes in their body composition or their weight. It could be a new diagnosis or a new prescription for a medication that has a food interaction that I need to go talk with them about. There's, some list of priorities. And then depending on that floor, I would kind of plan out my day of what patients I was going to see and when. I would always touch base with the nursing team. The nursing team is my core people, my best friends, because they always knew everything that was going on. And I would have all the patients that I would need to see, but every patient has a different kind of plan for the day as far as their care plan goes, and are they going for different tests, procedures, evaluations, something like that. So planning out when I would see each patient and timing it out for meals. If I needed to change diet orders, if I needed to be with a patient when they were eating to see if there were any oral issues. I'm not a speech language pathologist, but that's something that I would sometimes work with. I'll get more into that when we talk about interprofessional work, but I would basically just get my list of patients. I would triage that list and prioritize who I needed to see. And I would just go through, see my patients, write up my recommended care plans for them as far as nutrition goes. I would also, depending on the day of the week, I would round. So I would go, there was a period of time when I worked in the dialysis unit within the VA hospital. And so we would round once a week with the providers when they were there. And I would also, I was on an acute care unit, and I would go to a discharge planning meeting. And so I had various set commitments each day that involved patient care and coordination of patient care, either while they were admitted or before they were discharged from the hospital. But so it was just a matter of figuring out how I was going to see all the patients I needed to see, and then attend the meetings with other healthcare professionals I needed to attend. In an inpatient situation, you see a lot of patients for a very short amount of time. And so you really have to rely on the other professionals in the building and in the units that spend more time with those patients and get to know them better, so that you can provide the best possible nutrition care. Pharmacy would be involved, particularly around those prescription changes. Specifically in the realm of nutrition, that would come up around anticoagulants, warfarin in particular. And so I would work closely with pharmacists for that. I would also work closely with pharmacists when I was working with my dialysis patients. And as their medications would be changed on a week to week or month to month basis, talking about nutrition implications for that and helping them to control their potassium, phosphorus,
Sure.
Levels, protein intake, stuff like that. Pharmacy, speech language pathology, nursing, social work, absolutely, particularly with discharge planning. Thinking about, okay, do patients have access to food? Do they live in a place where they can prepare food, store food safely? Do we need to get them connected with food resources in their community? So really, nutrition is kind of like a tree with very wide-reaching roots as far as interprofessional work goes.
For early learners who will be watching this, what kind of skills do you think are important for this kind of collaborative work?
Active listening and problem solving. So one of the things that is often the case with nutrition is, there's no situation in a clinical environment where someone is, intentionally overlooks an aspect of care. But it's really important for dietitians to be in these interprofessional conversations because we have a unique lens at which we look at clinical care, and we're really looking for opportunities to improve health through nutrition. And while other healthcare providers do have training in nutrition, it's just different. And so the role of a dietitian in clinical environments is to really advocate for where can nutrition be incorporated, where does an approach need to change, or nutrition need to be really critically incorporated into a patient's care. And so active listening, particularly in the interprofessional settings, sometimes dietitians can get almost stuck waiting for someone to ask, okay, now it's time to talk about nutrition, as opposed to really looking for, okay, where are our aspects to introduce a conversation about nutrition when talking about clinical care. So really active listening with patients, but also with other healthcare providers. And then also problems. I talked a minute ago about discharge planning and thinking, okay, what's a patient's access to food? It doesn't stop at the doors of the hospital, just like any other aspect of clinical care. You really want to think as a dietitian about, okay, it's one thing to get them nourished in the hospital. We want them to stay nourished and to continue to nourish their body appropriately. And that involves food access and really advocating for how can I support them in solving their barriers to health behavior change or food access or something like that.
Was there anything else that you wanted to make sure as you looked at those questions that you would want to just say to your future colleagues who are just getting their toe in the water with the learning about the importance of interprofessional collaboration?
I would just say to future dietitians as they're working through their training, etc., just to really remember that they're an important part of the care team, and it's very important that they, kind of always ask themselves, is this an opportunity for nutrition to be considered? And the answer isn't always yes, but it often is yes. And so just to really try to stay keenly aware of that and get to know every other health profession that you're working with, because they are all so integrally involved. And that's really at the core of everybody has the same goal of helping patients and helping to improve health. So working together is just such a critical part of that.
Well, it was nice to talk with you, and I'm sure this will really be interesting and helpful for the students and get them energized too.
Yeah, absolutely. My pleasure.